some balance. You know, it's not all about teeth.
Definitely. And I guess that quite nicely summarizes what tonight's about. I mean, our subject tonight, we were going to call this one, lifetime care. We'll get on to that. But I think what we thought we would do is just, have a few questions about maybe, what made us start out. We've got lots of other subjects coming up, and some of those will split off tonight's conversation as well. And we can make it a little bit more interactive and maybe look at some people's cases and stuff and our own cases as well. But what I'll do, Ian, is I'll kick off with a question.
Okay.
You're welcome to fire it back at me at any point. But I'll ask you the question, and it's the old classic. But I guess the question is, so why get into dentistry? Why did you get into dentistry? And then maybe we should think about why anyone else would want to get into it now.
Okay, so I mean, the truth is, I think like lots of young men, I'm probably a bit of a drifter, and so I went to school. I mainly went to school to play sport. There was lots more things more interested in life than education back then for me. But I ended up doing sciences at A level, and then what you do with sciences, so I like to do practical things. My background is pretty working class. My brother had gone to university 3 years before and blown what little funds we had. So I was looking for something that had a job at the end of it, and there was a couple of my pals had done dentistry, and I thought, well, that's a practical thing. It's to do with science. Give it a go. And so it's a fairly pathetic way of getting into dentistry, but it is the honest truth. I mean, all these. I always worry a little bit about people say, "Oh, I've always wanted to be a dentist." So you might bear that in mind if I ask you that question. But there was plenty of things that I felt like doing. I mean, most to do with sport and other male type pursuits. But dentistry was something I just sort of I almost drifted into. Fortunate enough to be smart enough to get in. It was back when I did it, of course, it was a little bit more back in the day when you needed decent grades, but you sort of needed a rounded life as well, and they took those sort of things into consideration. So I managed to persuade them that I would be suitable for that. So anyway, that's how I got in. So it wasn't earth shattering, that's for sure. And then
I think that's fair enough.
How about you?
No, I think that's fair enough surmise. I think particularly you're saying about grades in a rounded view. I mean, that's something maybe we'll come back to in maybe today or maybe in another sort of talk that we do, is what is involved. What do people have to do to get into dentistry, and do we have the right people, which is an interesting aspect, because again, the way grades was one thing, but you're right, there seemed to be a different approach, maybe some of which now is not so politically correct, believe it or not. My own reasons for getting into dentistry, I put my foot in it too much. My own reasons for getting into dentistry, well, basically back in those days, it was, from my background, with parents as doctors, South Asian. Basically, we got told either you're going to be a doctor or a dentist or a lawyer, or maybe a pharmacist if you didn't get into any of those. And no disrespect to pharmacists out there at all. So it was a bit of a strange one, really, because the whole family were all doctors, actually. I had a cousin who was a dentist. He still is, Mansour Qureshi, and I just spent a couple of days with him and think, what does he do? And, it's as shallow as, he seemed to enjoy what he was doing. He was reasonably free in what he was doing, in that he said, I can come in and go home whenever I like. No one tells me what to do. And at the end of the day, he jumped into a nice little red sports car. It's very shallow, but when you're 16 years old as a boy, no one's really expecting you to be thinking poetically the whole time and thinking about the whole world. You're pretty much thinking about yourself. So I chose dentistry, possibly not for the right reasons. And yeah, just again, kind of luckily, well, I suppose we'll get to what happened in our careers. Luckily, managed to get in and sort of get through. So yeah, in hindsight, I guess a question to ask you: in hindsight, if you could go back and knew everything you knew, would you go back and do it? That's a good one.
Yeah. I mean, we could. What's the right answer? It's
And you can't go back and bet on the football or this and that. But if you could just go back and choose a different career, would you? I'm not sure I would, actually. But.
No, I mean, it's been a very good career. I mean, I think sometimes we don't appreciate the great thing about dentistry, like you just said with Mansour, is you can manipulate it any way you'd like to do. So if you want to work a little bit more, you work a bit more. If you want to be off when the kids are off, you can be off then. Yeah. As my children were growing up, I've been able to take them to school some days, pick them up other days. I could change my working hours, and I was sort of largely my own boss.
Yeah.
So I know. I mean, you really can't knock it too much, and I think we should be grateful. I think I mean, also back in those days, I have to admit it was a lot easier because there was much less, probably much less political correctness, but also much less all administrations that we have to do these days. Because I think the dentistry part of what we do, people enjoy more. I think it's the business side and all the things that we have to do these days that really, most of us, however we've got involved in dentistry, are there to treat people and to do clinical things. And then when you're having, I don't know about you, but for me, I mean, we didn't have any business coaching at all. So you come out and you're running your own little business as an associate. And then if you take on a practice, you're trying to run a business that you've no real training how to do. And then you've got now with all the CQC things, it's a lot of stress and it's a lot of stuff.
Yeah.
That people have to suddenly learn when they've really been trying to learn how to do a root filling, So it's no wonder it's a stressful job.
Yeah, I agree. I think we easy to talk about it, but I think we had it good. We had some very good years. Maybe we could argue that the guys before us had even better years. I don't know, but we certainly saw the years where you had less interference. And dentists could just get on and do what they needed to do. We didn't have the technology, so it's literally kind of you take one thing and have the other. So now that the technology and the things that we can do, which obviously we'll get onto, it's amazing. But it just seems to be in this environment of fear, which seems to be quite sad. But hopefully we'll help people understand that you don't have to have the fear if you approach dentistry in a certain way. So I think it's. I do feel sad in a way, the way I've seen things going from a political and a defensive dentistry style point of view. But equally, the technology everyone has now is just mind blowing compared to the sort of things we had and we had to do every day. You can make a career nowadays out of not even sticking a needle in anybody and just sticking a bit of bonding on the teeth and whitening them, which, funny enough, is what I do. So, I don't even look at blood. I don't even see blood all day long. So it's a crazy thing. But the reality is that I think it's quite healthy to have gone through the whole thing where we saw it all change. But equally now, and I know we've talked about this, I think we both feel we want to try and. I mean, it's a nice idea, but whatever we can do to try and help and put things back to how they should be. It's a dreamland scenario, but I guess the only way it would happen is by talking about it and helping people understand where we came from.
No, well, exactly, and I think people sometimes. I mean, you got the whole Facebook thing, which that I try and stay away from, but it's people sometimes see where you are now, and what they've got to realize that we're not overnight successes. When you see that comedian on the television, that he didn't just turn up last night. He's been doing this for 20, 30 years. That gets you to that position. I mean, I've been through the whole range of things. I mean, if you talk about our sort of journey with dentistry, and back in the day as well, dentistry was one of those things that you owned up to after maybe you'd admitted that you were a tax inspector, or a solicitor. You didn't. No one really liked the dentist because all we did was pull teeth and do fillings. And then now we have excitement about making nice smiles and all those beautiful things that we can do as well, which has really raised the profile and also created new challenges for us as well. But I started off, I try and do it as quick as can. Started off, I would just, my background's a little different. It's pretty work. My father left school when he was 14, worked in a factory. I was just grateful to be earning a few pounds when I finished. We didn't have to do VT back in those days. So I think I was taught dentistry by my dental assistant back then, which probably explains a lot. But she was great. First of all, you learn a little bit about dentistry. And then over time, I learned about running a practice. And actually, after a while, there's a bigger story in there, but after a while, I actually got really, really bored after about 10, 12 years. And I was thinking, if this is me, if this is the rest of my career, I don't want to do this.
Yeah.
And I was really, sort of almost at the point of thinking, can I go and do something else? Because I was really going to work to earn money to try and do other things and trying to get my pleasure from other parts of life. They always, there's an old saying, which is when the student is ready, the teacher appears. But actually, it wasn't even so much that. It was just a period of time. I've always tried to be the best I can at whatever it is I do. When I played sport, I tried to get as good as I could. And with dentistry, I was trying to improve, but there just wasn't so many things out there. Most of the things in those days were hospital-based. Yeah. And actually, the first thing that I came across, two things. One was endo, when rotary instruments came out. I'm admitting my age now, but when I'm thinking, I could do endo, I could be an endodontist. And I thought, how boring is that? But it was something that was one of the few things that you could actually get better at.
Yeah.
And I remember, people don't realize it, but I'm actually quite a shy person. And I went to this Section 63 course, this guy talking about endo. And then he, I waited till the end and I said, I'd really like to get involved, try and get as good as I can. And he goes, well, it's a 3-year course, full time. I said, well, I've got a wife and a child and a business. Well, it's your choice, and it made me go away and think, I just can't do this. I can't get better. I'm stuck. Yeah. But at the same time, not long after that, I read a book by a fellow called Paddy Lund, who's a crazy Australian dentist, who'd sort of largely been through the same things. And he talked about the happiness-centered business.
Yeah.
About how you could be yourself and maybe create a practice that was a reflection of yourself. And so I sort of started on that pathway. But part of that was taking care of patients and being really customer oriented.
Yeah.
I
remember him actually, and sorry to interrupt, but I remember him, and actually you said a few things that ring kind of, quite true with how my experience was. I'm probably a few years younger than you, not a lot, but just a little bit. But I think we kind of went through a sort of similar, because I had a similar sort of thing. For me, it was probably around about 4 or 5 years in where I was just really ready to give it up and do something different. Because as you say, dentistry was just, you just went to earn the money. You didn't really enjoy it. Patients, particularly I have to say, working in the NHS system at the time, that I didn't really enjoy the kind of interaction, the expectation and everything that you had with people. And actually, you mentioned Paddy Lund. That was actually one of the first courses kind of courses I went on that I paid to go on that wasn't Section 63. And it was back in the day, if I'm right, it was like one of FMC's first things, wasn't it? And I think they've been around for a long time, but I think we do need to sort of thank them for I think they really did help to kickstart a lot of what went on in the UK, actually. And I'm not just saying that to be nice to them, but but actually, I remember. So sorry to interrupt, but Paddy Lund. But my question is, well, I'm sure you're going to come to it. What got you into Dawson? That's the question. I was going to ask.
Well, I was, as I say, I was always trying to be good as a clinical dentist, and so now I was then concentrating on trying to make a nice, happy practice where you went to work, the patients were, and anyone who wants to read that, you can go online and read about Paddy. I like crazy people probably because I'm one of them, but the patients came in and they had a lot of challenges, and I was frustrated because I couldn't solve a lot of them. Tooth wear, we were taught fixing teeth, single teeth. And, you know, and I just couldn't help a lot of it, you know. And so I went on quite a lot of courses that, you know, as you say, FMC were instrumental in those days. We do need to be grateful for people like that. But I kept getting stuck, and I'd read some of Pete Dawson's book, you know, I maybe read a page, fallen asleep, read another page, fallen asleep. So, but I could see that was interesting. And then it was actually a lecture called the Cosmetic Occlusal Connection. And it was John Cranham. And I remember seeing this flyer came out, and, you know, cosmetics, I really was always fascinated in how because bonding was coming in just after I left university, veneers, all those things were starting off back in that time. And so I was always intrigued as how we could use those things to make things look nicer. So cosmetic was really interesting. We were just about to hit that cosmetic wave that came over from the States. But like most British people, certainly I think Europeans as well, we understood that it had to function as well. It had to work, otherwise things were going to break. And so when John came over with that lecture, you know, it really combined the two things. So I didn't know who Cranham was at that stage. You know, he was new on the scene. But the lecture title was very enthralling for me. But it was in London. And as a northern boy, I'm not going to London for a lecture, because it's just, I mean, why would you? You know, all that money to go to London. Well, the fortunate thing was that he came and did one in Bolton, which is by Manchester. And so I went there.
Right.
And it was just one, you know, it was one of those things when you listen to someone, I was thinking, you know what, this is beautiful dentistry done with good function in a predictable way, with the patient at the center. And that really, it really struck a chord about, this is what I want to do. And again, being the silly person that I am, you know, I didn't like to push forward, you know, but it was actually my partner that was with me. He says, oh, well, let's go and say hello and whatever else. And long story short, John and I became friends. Back in the good old days of dial-up internet, we'd sort of communicated with a little email on there. And at the same time, you know, so I found out John had been, his training and why he knew about this was from the Dawson Center, as it was back then, learning from Pete Dawson. And so I sort of started to revisit those things. But obviously for a boy that would just about managed to go to London, to go to America for training was a big step. But just after that, we had that cosmetic wave with Larry Rosenthal and all those people. And, you know, I know that there's a lot of things that we say about that whole deal, you know, and it saddens me to think we've gone back a little bit to some of that stuff. And that's another story. But they did bring a sense that you could do stuff and you could make smiles better, and that you could have fun doing dentistry. And so I went through that, and I got really excited about making nice smiles, and, you know, you get too involved in it all. But at the same time, I was very fortunate. There was a guy who helped with that called Kenny Hamlet from Texas, and he sort of was had done some Dawson stuff. And actually, I came across Cranham a couple of times as well. And so at the end of that, I then went back and did all the Dawson stuff to learn about the function that would make this work. And it really came together because, you know, you know as well as I do, Tif, because I want you to tell your story about sort of that cosmetic era and why you've gone the direction that you did. Hopefully we did as well. But, you know, in those days, it was about taking some nice teeth and trying to make them look nicer. And I just didn't have those patients, and I didn't want to put veneers on nice teeth. You know, so most of my patients came in with worn teeth, with old crowns, with missing teeth, with screwed up jaws. And so if I was going to make nice smiles, I needed to understand all that as well. And that's why I got involved with the Dawson stuff through John, and just from this philosophy of care. You know, it's much as I'm associated with them, it's not exclusive to them. You know, obviously Pankey was before that time who Pete Dawson was associated with. But it's that philosophy of care that really has been the backbone of everything that I've tried to do. And then through Pete, I learned that it wasn't about occlusion. It was about this, what he called the concept of complete dentistry, which, I mean, to sum up these days, is about teeth, it's about perio, it's about cancer, it's about joints and muscles and occlusion, it's about airway, it's about smiles, it's about all those things. Because no matter what patients ask you for, they want that whole package. They want health, they want function, and they want things to last. And I know it's one of your big things that if you stay in your practice long enough, you get to see whether that's working or not.
Yeah.
You know, and it's really cool. I mean, our hygienist was in today. I had probably 5-6 hygiene checks, and you see people that you've known 15 plus years that maybe you've done some work on, and they're doing well. You know, whatever level they wanted to achieve, we've helped them to achieve that level and then maintain them as well.
Yeah.
And I think, you know, again, one of the things I learned from Pete was this idea of goal-centered dentistry in the unique goals. What's your goals? You know, if your goal is to earn loads of money, I'd go and do something else. You know? If your goal is to make beautiful smiles, well, that's one thing, but you probably want to practice. You probably want to change practices every 2 to 3 years. You know?
Well, that's a very good point. I mean, I think you kind of hit the nail on the head there, really. I mean, I would totally agree with you. Seeing people again that you treated and you see them when they're stable. I mean, you know, now for me, that's become probably one of the most satisfying things that you see every day in practice. So it's always great to be able to fix someone who's got bad teeth and to sort them out and do. But when you know that what you've done has actually worked, not just aesthetically, but very important functionally, it could be for 2 years, it could be 5 years, it could be 15 years, then you really know you've done it right. And I've sort of had this little bit of a bee in my bonnet recently about that sort of treatment and what our intent is. And I've been saying it quite a bit in some lectures, saying that whether you're doing, because this sort of treatment is I'd call it a pseudo specialism, in that you're doing something that it's quite complex, quite comprehensive. And you can call it, I know we're not allowed to call it specialism, but it's a kind of specialism. But you could even apply the same thing to specialism, in that I really think if you're doing something that is going to reorganize a patient in any way, whether it's orthodontics, periodontics, restorative, or a mixture of everything, you have a responsibility to that patient. And I think one of my biggest problems in dentistry, and I know we are going to cover this sort of subject on another talk, but one of my biggest problems in dentistry is the way dentistry is structured for the convenience of the dentist's career, not the patient. I think that if anybody who is doing any form of specialism should actually be able to somehow follow up those patients. And whether even it's a specialism or pseudo specialism, you should see those patients again. If it means you see them remotely, if it means you connect with a dentist looking after those patients, there's no point being a kind of big shot dentist doing massive treatments if you've got no idea what your treatment looks like 5 or 10 years later. And that, I think, is one of the fundamental core problems with dentistry. We'll probably never change it, but let's talk about it. So I think you're absolutely right there. But you touched a little bit on complete dentistry, and I know you put that quite nicely, but just, you know, briefly for those guys out there, because I know you use that term a lot. I know what it means, but for those guys who wouldn't have heard that term before, just sort of briefly summarize to them what complete dentistry means.
So, I mean, complete is, we often think about, you know, with dentistry, we often think about procedures, or we think about materials. You know, the latest, greatest things, zirconia or an implant procedure or whatever. When really what I believe our patients want are beautiful smiles that are healthy, that work well, and last for the rest of their life as best as we possibly can.
Yeah.
So those, going back to goals, that's what it is I'm trying to achieve. And those are the goals of complete dentistry. My goal is not to create a beautiful smile with a perfect occlusion, but to create an appropriate smile that we can help that patient be happy and healthy for the rest of their life.
Yeah.
And so not for 20 years, not for 30 years, but for a lifetime. And that's why when we get into our minimal invasive stuff, that restorative cycle becomes so important, particularly with younger people.
Yeah.
No, but that's what complete dentistry is. And so, just to go back over that as a dentist perspective, I'm thinking about teeth. I like teeth. That's what I do. I'm thinking about biological aspects, which is caries, etc. But I'm also thinking about structural issues. Perio, obviously more biological stuff, maybe some occlusal problems. Cancer, if you could save one life, that would be an amazing achievement. I think that, we're so fortunate as dentists that we get to see these patients on a regular basis as well. I'm sort of, without getting into, all the stuff, I'm sort of quite holistic. I like to try and encourage people to be well, to look after themselves, because I think what we do is part of that. So cancer is really important. Airway is becoming more important now. I think oxygen, it's always good to get a little bit of oxygen in there. It helps you heal and helps you stay well. Obviously, joints. We treat teeth as if they're not connected to anything.
Yeah.
And the joints and the muscles and the teeth are connected, and the nerves as well. And we need to understand how that system works. But not in some silly theoretical way, but in a way that makes our practices and our treatment better, that allows us to achieve those goals. That's really what it's about. And then on top of that, you've got the smiles. That's the smile bit is the icing on the cake. It's the bit that I like the most.
Yeah.
But none of that works if it's not appropriate, if the teeth aren't healthy, and all the other stuff going on in there. I mean, we both know from bitter experience, I'm sure, or I'll just speak for myself first anyway. Nothing makes these cases fail quicker than poor biology, or, maybe a bad occlusion or things like that, And so to just think that we could put these smiles up there, whether it's bonding or veneers or whatever it is, and they're going to do great for the rest of their life is nonsensical.
You're right.
It just isn't going to work, And it's the same, you talk about people seeing their patients, it's the whole ortho deal, isn't it? It's like, if you saw your patients 10 years later, maybe you'd think differently.
Yeah, you're right. I mean, I think that this is a subject I think is going to be talked about a lot more, not just within ortho, I guess, but within most fields, because there has been this sort of idea that you can just treat somebody, send them off, and then that's it. And there's without being too political here, there's a lot of taxpayers' money gone into that area, and we need to sort of think, well, what's happening with these people? I think what you've been talking about with complete dentistry, it makes perfect sense to me. We've talked with tonight's subject is lifetime care, and I often talk about the lifetime patient, and I'm looking for very similar things. I've got maybe slightly different angles that I look at, but fundamentally the goal really for me is to keep a patient's teeth healthy. And I know you often see patients at different stages, because you get a lot of patients referred to you. But one thing I try and do, certainly with the patients in my own practice, is to intercept. It's one subject. I know a subject we'll talk a lot about later on, and another day we'll do a little bit on DAL, but DAL is one treatment that I'll use as a very simple, minimally invasive interceptive treatment. And when I show some cases that I do to dentists often say to me, how do you get the patient to have that done? It's so little wear. But what it all comes about is by talking to that patient every time you see them, the patient can start to understand what's happened to their function and guidance as to why it would be a benefit. I think most of the time, too many patients are treated too late. They usually are treated too late when a lot of stuff starts to break. But as I know I've seen you talk about in your lectures, I think if you pick things up early and you communicate with the patients much more quickly, you can actually then provide a simpler treatment that they can probably afford and stop them going down that pathway. So I think it's a very sort of similar approach. I've liked what I've seen in Dawson lectures by yourself and other Dawson speakers as well. And it really makes sense to the way I feel about things as well. So yeah, I mean, I think the concept. I mean, that was going to be one of our questions. What are your thoughts about the concept of lifetime care? And I think you've answered that quite nicely. And I think also purely from out there in the profession, we've been talking about how could dentistry be better? Well, I think if every dentist was brought up with the idea of, or trained with the idea that you're going to see these people and you're going to be committed to these patients for perhaps many years, I think we would think a little bit differently about what we're doing every day. But I'm afraid I think that's changed a little bit over time, partly because a lot less dentists will own a practice, and probably as a result, a lot more will move from place to place, which actually makes them, in my opinion, a bit less experienced. They don't know what their work is like 2 years later, 4 years or 5 years later, which then helps you doesn't help you learn. So yeah, I mean, I think lifetime care is a critical thing.
No, I think so. I mean, it's seeing those patients. I had a patient come to see me just this week who I'd seen one of my previous practices in St. Helens. I know it makes me a bit 30 years ago, and you're thinking, and and they said, I said, why did you come to see me? They said, well, you did these things for me, and they're still there. And I said, well, that's amazing, because 30 years ago I didn't know anything. So. I was just lucky back then. But they came, I think, not just because of that, but also probably because you cared about them and you spoke to them and you developed a relationship. I live in the community that I work in, so I see the people that I treat in Tesco's and in the gym. So you don't want to be hiding behind the lockers because you did something that you shouldn't admit to them. And you want them to say nice things about you. It just makes everyone feel good. So, but I think when we talk about lifetime care, one of the things that without making this too much patting each other on the back, Tiff, I think one of the things that I sort of went into that sort of complete dentistry occlusion thing because I knew I needed to make this work well. But I think one of the things that we all, well, not separately, but we sort of saw and we didn't like. And then people like you really did something about it, which is to say, these teeth do need to go there to look nice, but there's got to be better ways than drilling them first, And so, that's when, that was, for me, is one of the reasons why I see people like you, and I'm so pleased to be associated with that, because you thought, let's get the teeth in the right place, and then we have to do so much little to them. I mean, I just wanted to, before I forget, I wanted to comment on that thing about interceptive stuff. Most of the time, the patients that I see are older and they're damaged, and it's a shame, and I see, I do get some of the younger ones, but, I see some of the things that you're doing, and that's fabulous. It's not about, that we get accused of over treatment, really, if they were cavities, you couldn't wait to fix them, could you? No, but maybe somewhere explaining how it happened and what we could do about it. But, going back a step further, now we know about airway and development and good orthodontics, to be able to get hold of the very young people and guide them so that they don't need dentistry. That would be a fabulous achievement, And I think that's something that we often talk about fixing things because it's most of what we do, but actually setting people up is fabulous, and I applaud all that you do, interceptively as well. I think we can go back another step as well. So
yeah, I mean that what happened to me back all those years ago was very much we started off in that similar sort of vein where we weren't happy with what we were doing. I think you entered that cosmetic area, in my opinion, for better reasons, because you were kind of going at it from a functional point of view. I got involved in cosmetics because I just like kind of cosmetics, and I was pretty good at doing composite build-ups and all that stuff. And yeah, I went on those. Certainly, obviously, I went on those veneer courses, and let's be fair, I learned a huge amount from them. I learned about photography. I learned about taking impressions. I just learned about doing things actually physically better. And there were certainly are still cases that I did 20 odd years ago that are still looking great. So some of them are good, but what I also learned very quickly while I sort of sat through that whole kind of concept was I just felt uncomfortable with some of the stuff I was seeing. And, you know, at the end of the day, I was feeling very uncomfortable with the stuff that I was having to do every day by just sticking metal fillings in people's teeth. So the ortho thing kind of started because, you know, I was sort of just looking at simple other ways of just jiggling things around. And one thing about King's, you know, I have to say that we did have a little bit, not a lot, but a little bit of ortho training. I'm going to swear now, we farted about with Z springs and a few other bits of things. So way before, a little bit actually, not way, but a little bit before in Manolida, I was actually messing about with Z springs, jump bites and that sort of stuff. And so that was kind of where I realized, plus the mixture of composite bonding, which was just starting to get better and more polishable because Renamel had been launched by Abbott, which is a really important material actually. So I think, you know, what struck me actually was that it was doing this ortho seemed so obvious to me that I kept thinking, and I have for many years, you know, why is no one else, you know, I was thinking, why is no one thinking this? Why is no one thinking that? But actually it was, I did push it, and I did kind of, you know, you come up against some people who don't want to hear it and all this sort of stuff. People can get quite aggressive about it because there were a lot of practices back then that were just basically set up to sell big veneer cases. That's the truth of it. You know, they were. I can kind of understand why. But certainly it made an impact. And now for me, what's been probably the most important thing is seeing those ortho patients, you know, those ortho restorative patients again, because actually I learned far more about restorative dentistry by reviewing my ortho patients. And patients I treated for ortho, thinking I was just doing it to make their teeth straight. Actually, what I realised was that they suddenly stopped wearing their teeth a lot less. Their guidance was being held. Their anterior function was more stable. Their bonding was lasting longer because their teeth were straight. And so actually ortho and patient reviews made me realise what ortho could do functionally. You know, and so for me now, ortho, I can't even imagine ortho without even thinking about function. You know, I shudder to think of just moving teeth around without having a plan for how they're going to fit together, having a plan for perhaps how you're going to treat the wear, where, you know, what the overjet's going to be, what the overbite's going to be, what the guidance setup is going to be. And I say to a lot of dentists, and anyway, if you're just moving teeth for the hell of it, don't move them. You know, you got to have a plan. So yeah, it was and has been a pretty kind of, you know, amazing journey. But one of the reasons why I was lucky to get to where I've got to comes back to this whole concept we're talking about tonight, which is lifetime care. And it's been seeing a quite large core group of quite a few hundred patients that I've treated with ortho again and again and again and again over the last 15, 17 years or so. And that's taught me more probably than anything, I think. No. Now,
I think sorry to take on that point as well. I think one of the things that maybe some of the younger people don't realize is that back then as well, orthodontists and dentists didn't really talk. You know, it's like we sent a patient to the orthodontist, and the orthodontist did whatever they felt like, and they would align worn teeth by the incisal edges. All these things that maybe we take for granted a little bit these days. Yeah. And so we couldn't get the things done by orthodontists as well that we needed to do. So it was a different time. Just to sort of, you know, get my bit in about complete dentistry as well. And I didn't realize this at the time. But if you look in Pete Dawson's book 40 something years ago, when we're treatment planning, we think about 4 options, which is reshape, which is taking little bits off or adding little bits on, reposition, which is orthodontics, restoration, which we all know about, and surgical. Now, when I first saw that list, I just thought, oh, well, I like restoration. But actually, what Pete was saying, look at them in this order. This is the least interventive way of doing treatment. And so, I mean, yet again, he was ahead of the time. You know, and I think then probably as Dawson did itself a disservice, because then we show a lot of, you know, full mouth porcelain and things like that, which don't really illustrate what he was trying to say, you know. But when I really started to understand those principles, and coming from the same perspective as you, that's when you did it yourself, which is amazing. And but I got involved with the FACE group, which is an orthodontic group who had the same sort of goals as well. So I think that's one of the other reasons why we sort of have this common thread, because if we can get the teeth in the right place first, actually what we do is much less.
Yeah.
What we do looks naturally beautiful, but also we keep patients out of that restorative cycle, and that's the thing that makes things last a long time. So, I often feel, sometimes you show these big cases and they're very nice, but they're crowns. But the best cases for me are, I reviewed a young girl that we treated with the orthodontist, and I'd done one incisal build-up on her canine, and she had the most beautiful, this is 5 years, and just to see this beautiful natural teeth, beautiful occlusion, but great health, so rewarding. I think not rewarding for my children's shoe collection or iPhone collection, but it was very rewarding professionally. So.
Yeah, well, you know what the thing about that though is that I found that if you actually are always, the less treatment you try to do, the more the patients respect you, and you can give the patient the whole range of options. But I found over time that if I talk the patients through all the options and just make sure they understand the simplest thing, and the simplest option, the cheapest option is on the table, they respect you more for it. And I think that, it is a subject actually I want to come back to later on in this series, is the politics of dentistry and the perception of dentistry. And we'll come back to that because I think it's really important, because I have to say, one thing that saddens me, that is that over 28 whatever years of my career, dentistry, the perception of dentistry and the way that patients view dentists isn't that different to how it was a long time ago. Yes, we can do a lot more, but I think that our representative bodies have let us down in our image, if you see what I mean. But we'll come back to that. But what I was going to say now, because I think we probably we're near our time, but I think a good bit to talk about now would be you can start with what advice you would give to young dentists on the subject of lifetime care, and a little bit of advice anyway. What advice would you give to on what they should think about lifetime patients?
I think that's a great question. It's a little difficult to answer as well, I think, but I think perhaps the way I'd look at it is, when I came into dentistry, we just looked at what patients needed. The patient sat in the chair. They opened their mouth. We told them they needed 4 fillings and a scale and polish, and we gave it to them.
Yeah,
that was. Then we got into the business of what patients wanted, and we were doing what the patient wanted. I was like, that's crazy. That's we're not going to get into any politics, but it's doing things that people that aren't educated in that field just want is crazy. So what I found was, if I could look at what they needed, but listen to what they wanted, and then to turn what they needed into what they wanted, So, if you see people with worn teeth and they want a beautiful smile, dentists, they tend to talk about dentistry. Well, let's talk to them in terms of that beautiful smile. They don't want to know about the mechanics and the material, and they want to know how we're going to help them. So we have to become much better communicators, and that's going to allow us to do the things that we need to do. But here's so that we don't get too over time. Dr. Dawson said he said lots of great things, but one of the questions that he always asked was, which of your patients doesn't deserve a complete examination? And what that means is, they come in and they tell us what they want, and those things are so incredibly important. But our job as the dentist is to do a complete examination, which means look at their teeth, look at their perio, look at their airway, look at their joints, muscles, and tooth wear, look at their smile, look at their cancer, and then to tell them in terms that will help them to improve their health, how we can help them, And I think if we do that, that's how we get towards this project of lifetime care. Because like you just put your finger on it as well there, which is, I made a massive mistake as I got involved in this, which is to make patients feel as though I had to do this all at once. Surely there are things that we have to do because of the way things fit together. But I try and explain to patients, these are all the things, this is what you said you'd like. These are the things that I've seen. And this is our plan that we could unfold over and maybe over a number of years to get there, And then I tell them, and there's two parts to treatment as well. Number one is to get there and achieve it. And then the second thing is to maintain it. Yes. And the patients that do the best are the ones that we maintain. Yeah. And I think the thing is, if we can start with a complete examination, have a great conversation with them and help them to understand, we'll get them to a place in a time scale that's appropriate for them, and then help them stay there or even improve further. I think that to me is perhaps the secret of lifetime care.
I think that's really, really well summarized. I tend to view it in a very similar way. I would probably sort of add that I try not to rush into things. Patients who come in and are kind of demanding big treatments, I very deliberately now do my very best to try and delay it to make them understand. Firstly, one thing I'm trying to do is I'm trying to suss out whether I want to treat this patient or not. And that's another subject, actually, which is kind of on our list, which will be the whole medical legal aspect and who are we actually treating? Because I believe our whole industry focuses us on treating the wrong patients. And what we should actually be doing is exactly as you've said, is educating the patients in your chair. And by talking to your patients every time you see them, not panicking them, making them understand why that tooth is worn, why this tooth is moving, why that one is chipped, why that tooth perhaps is getting knocked by the lower one. They will often then come back to you in 6 months or a year or 2 years or 3 years and say, that thing you were talking about, I'm kind of getting it. And so ultimately, as you exactly said, you're in the process over a lifetime of educating your patients. So actually now most of the patients that I'm finding I'm treating are people that I've been speaking to for the last, could be 1 year, 2 years, 5 years, or 10 years. And you know what the best thing about those patients are? They love us. They're not, it's so much less risky. You know them. And this is a subject that we will talk about, because I genuinely believe, and I'm trying to find out some statistics right now, is what patients actually turn around and make complaints about dentists. And I would bet if you ask anyone who's had a complaint, those patients are less than a year old, or maybe even 6 months. Whereas, I can't think of anybody I've known who's got a patient they've had for years and years and years, unless they've seriously neglected them, whose patients turn around and bitten them. So I think it's really important that we sort of have a different view of who we're treating and why we're treating them. And the question we've asked is to young dentists, what do you say? And I say that because what I see out there worries me, in that there seems to be, this whole kind of race to the, I wouldn't call it race to the bottom, but a race to get somewhere, where they need to do their composite bonding course, they need to do their short-term ortho, they need to do their Botox and fillers, they've got to get this, they've got to get that, they've got to do implant course, and they've got to get to a private practice, and then they're going to be another and actually I find that quite sad. You know what? A lot of dentists say, I need to find a private practice. No, you don't. Work in a national health practice and convert those patients. That's what you need to do. That's a skill that's gone. I know it's not as easy with UDAs nowadays, but if we could, if you could put that in a bottle and explain it, you'd never stop selling it. It really is something which is missing from dentistry, probably because I think there's a serious lack of mentorship now that comes out from university, then VT. What I had and what you had back in those days, where people could talk to. But I really believe that if dentists young dentists started to think about, it doesn't matter how bad your practice is, you can make it great. My practice was not great. It was in a terrible area. It's still in a terrible area, but it was in a terrible area and completely 100% NHS, a lot of exempt patients. And just by talking to patients over the years, we made them understand the value in what we were doing. Made the patient think less about money and less about, this guy's trying to do this, trying to do that. And that, I think, if we can, in this series of talks and anything else we do beyond that, we can get some dentists to focus back on that. I think we would have done a reasonable service for people.
No, I think so. Going back to that point about getting to know your patients, one of my mentors always said, date them before you marry them. which is probably a sensible idea.
Yeah. I think you're allowed to say that nowadays.
Well, whoever you want to date, it's like,
it could be a male or a female. Doesn't matter.
Anything we like, yes, Yeah. So, but that's an important thing, getting to know them. And, I think sometimes, so, I mean, I'm just a normal guy. I know you're a normal guy, but people, sometimes we forget as well how people look at us. And it's like, we got so many stories. We didn't just get dropped in this position. It happened over a long period of time. And, we still have those challenges every day. I still have challenges with patients, with staff, all the other things that people do. But my practice is skewed these days. It's skewed from the way it was back in the old days in St. Helens. I mean, I got so many stories. Just very quickly, I remember this when Pseudo crowns first came out, and I was so desperate to do. I mean, I probably get reported for this now, to do some all porcelain crowns that might be strong enough. This lady came in. She seemed like a nice lady. I tried to persuade her. Oh, she didn't want to do it. I ended up doing Pseudo crowns on the National Health Service for her and getting a lab bill that was bigger than the fee that I got paid. She sat in the chair. I fitted them, and she said thanks and disappeared. The same day, there was an older lady came in, and we talked about the same things, and and just because I was enthusiastic about it, and she never came back, and I wouldn't say distraught. I was upset because I thought I'd upset her, and that I hadn't, several months later, the first lady, I get a message. Could you see so and so? But she's in a rush. A car is parked on double yellow lines, and she's broken a tooth. She'd really like to see it. So being brought up Catholic and a dentist, I always think I'm guilty of everything. So I thought it must have been one of my teeth. So I saw her, and I looked out the window, and there was a brand new Mercedes parked on double yellow lines. She came in. She was brown as a berry. She'd been 3 weeks in the Seychelles, and I'd given her 2 free crowns. And anyway, just to make things worse, later that week, probably almost a year after I'd seen her, this nice older lady walks in with an envelope. I gave it to the receptionist, and she said, Ian talked to me about these 2 nice new crowns you could do for them. I can afford them now. And she handed over basically pound notes to get them done. Yeah. And, I wouldn't say in that moment, but that was one of the illustrations. You know what? Just tell people what you can do. Yeah. And you'll be surprised, who will do it, but you'll also be surprised who's grateful for it as well. Yeah,
you're right. You know what? It's a great story. And what I often say to people is tell, don't sell. If you tell, you keep telling, the patients will come back and they'll ask for it. If you sell, well, you know what? You might do some good cases, but the likelihood is you're probably going to treat the wrong case at some point. And I think that's a pretty good message for us to probably finish. We're trying to keep these to an hour, aren't we? For 1 hour. Other subjects coming up that we've got on our list. I think the dental politics is going to be a good one. Now, we might have to check our legal status. Maybe we save that one till the end of our career, Ian.
Well, I'm getting closer to this, though.
But anyway, that's dental politics coming up. And we've got another subject, which is checkup examinations. What do you do? And I think that'll be a good one, just to, we could do a little checklist of the different things that we do, which I think people will find really interesting, actually, because, I know when I talk through some of the things I do, a lot of dentists will write it down, we've got, where the politics of dentistry has taken us, who is teaching us, why GDPs are undervalued. Well, that's a good one, and what they can offer. Another one we've got is research, a lack of versus common sense. And that one is going to be a big fun one. We're going to talk about composite layering, wire retainers, composite veneers, etc., etc. Another one we've got is treating tooth wear. We've got that one called It's About Wear and When. And with that one, we'll talk about all the various ways of doing that, amongst other subjects coming up. So I will just say thanks for joining me, Ian. And I think we will reconvene. I think the plan is in about a month, isn't it? We'll try and do one.
Yeah, I think so. I think, we're going to try and keep them to about an hour, talk about all these different things. But I think, hopefully it's going to be entertaining and useful for people to learn some things and to see what we get up to. But if they've got any comments or thoughts about what they'd like us to talk about, they can email whichever of us that they know, and we'll try and get.
We post this. I mean, it may well be we'll be posting this on YouTube, I'm guessing, as well, and you can stick it in the comments below. But you're right. But you can email and maybe even send in pictures. We can do a screen share as well, and we can post something up, and maybe let me just check and see if this screen share works. Let's do a live demo of it. So something like this, just to give everybody an idea of screen sharing. So what it would mean is, are you still there, Ian? Can you see the picture of the teeth? Possibly not. Maybe.
I can see the teeth, and I can see someone who's got more cars than they should have. Yeah.
Oh, you can see that. Oh, you're not meant to see that. Never mind. Oh, what I was trying to do was just to share. What I was just trying to do was share the screen. So anyway, we'll share some pictures of teeth, and I think it'll be quite a good one. We'll be talking about maybe talk through some cases, what we would do the same, maybe what we do differently. And that can be quite good as well. So I think we should sign out. So thanks very much for joining me. Thanks to everyone for listening, and see you in about a month or so.
Look forward to it. Thanks, Tif.
Take care.
Bye.
I'm going to